Because I want to make sure Allison can hear as well.
She's like staring at it like this.
So you guys, this is the very top of the head here. Okay, so if I flip this around, you can see that's where the hair, you see the hair and everything. So we're way up here, the top of the head here when we're looking at this. Okay, so this is your first section. So go to this page. Yes, that's the page you're going to fill in. So you'll see on the right hand side that you'll see an actual black and white of the cadaver. You'll also see this image here. See that? And this is the answer. So that's another thing you need to come back and work on. The answers to the numbers on there. You'll see these here. Okay, so come back later to do that because I need to go over the cadavers with everyone, okay? All right, so let's go over this. So this is what should be your fill-in. If you notice, there's a sheet right before it that had these listed to kind of tell you what you needed to put in the blanks. Okay, so just to give you that heads up. So I always have that card to make sure that all the fill-in-the-blanks at least get covered, even if I get in a hurry, at a minimum. So if you look here, this is the scalp itself. This like brownish part is the bone. So make sure you can see. Can you see okay, Allison? Otherwise you can come on.
I'm gonna send you this video.
Close. So, as well. So, blue is a vein, red is an artery, yellow is a nerve, okay, and green is a duct of some type. So that's how they color code these. So we see two blue structures, anteriorly and posterior. That is the superior sagittal sinus. Remember how I said that it kind of curves. So if we slice through it, anteriorly and posteriorly, we see that superior sagittal sinus there. This is that falx tree. See how dense that is right there? Mm-hmm. And this is parietal lobe. So bone-wise, this is frontal bone and this is parietal bone.
Okay.
Okay, so let me know if I miss anything on your list. As I say, you have this list, okay? Just so you know, you have that list. Okay, so, and I really would like, though, I know you want to videotape, but I would like you to be doing what they're doing too.
Okay.
Filling in their blanks.
Gotcha.
Okay?
Gotcha.
If you could please do that as well.
It's like the after.
Yeah, it's after your worksheet.
Right here, the first sheet after. Oh, where'd my pencil go?
It's not a lot of things that you need to, so.
Excuse
So
me, my
what are your
pencil.
three
I don't know
blanks?
where it went.
Sorry.
No, you're good.
So it points to it posteriorly. You guys see that on the superior side of the spine? It points to it posteriorly.
Excuse me, guys.
but anteriorly as well. Okay. And if one of you wants
Still can't remember what numbers go to what things.
and help each other out with filling it in later, that helps a little bit.
Okay. I'll just send this to anyone that wants it,
Yeah, and
just
you
so
guys will
everyone
help
wants
her
it.
fill in her blanks, okay? And make sure
Yeah.
her blanks are filled in. So that's gonna be, of course, your parietal bone back there. And then this is gonna be your frontal bone here.
So that's all you need to know for that one.
What else is on
she
here?
has-
What else is labeled on here?
Central sulcus.
So you can see what else is labeled on here.
Oh.
Is the other things that you have to know.
Okay.
Now, I'm not going to ask you these three. These are the parts of like the different sections of the bone. I wouldn't cross that off because you might have to know it for another course.
Right.
Okay, it is on
okay.
there, but it's not something I'm going to ask you.
What does
okay?
that say?
And so this is the scalp.
Oh, okay.
Okay.
That's scalp.
You said this is frontal, this is parietal. Or
Bone.
bone, right.
Yes, bone, and this is lobe.
Right.
Okay. Does that make
Gotcha.
sense?
And that's parietal lobe. Okay, cool.
Yeah. Yep, that's it.
I'm sorry.
Oh, you're fine.
No, you're fine.
We're all close.
Okay, does this make sense,
here.
you guys? So, okay, then go to this next one here.
These are really
So-
cool.
So I'm going to flip this around again. I want to show, oops, this one is the one I want to flip around. So you
Oh,
can
wow.
see here that you can actually see the anterior horns and the posterior horns. This is actually the body and then the anterior horns, posterior horns. This here is is more superior than this.
Okay.
Now, again, we're looking at all of these inferiorly, just like you're going to look at them on an image. That's why we're looking at them this way, so they look familiar to you, so that rights are on the left, so that it kind of sticks in your head that way, because otherwise it's too confusing for you to have to look at it from two different perspectives. So that's why. But so once in a while you'll see me flip this around so you can see something from the superior perspective, just because we're missing this anatomy, because look how thick these sections are.
Wow.
They're very thick. And so we miss some anatomy sometimes because of it. So you'll see me
Pretty
kind
cool,
of flip
okay.
one around so you can see it, okay?
Okay, so go ahead and what did we say? You said this is the anterior.
So here's where the
Anterior
anterior horns
horns.
are. Here's the posterior horns. This is mostly the body of it, of the lateral ventricles for the most part. We're seeing the majority of the body. You only had to label it as lateral ventricle here. Here I would more ask you to label it as frontal and posterior horns. Anterior,
more visual.
sorry. Anterior and posterior horns.
So for this
Yeah.
actual one right
So.
here, you just want it to say lateral
You can just say
ventricle?
lateral ventricles. That's fine. It is anterior and posterior horns a little
But you
bit
don't have
too,
it,
but
you don't have it pointing to the posterior.
not really. So just lateral ventricles is fine on that one. Okay, remember how I said those little arteries that you see
Right.
following that falx cerebri, that longitudinal fissure? These are anterior cerebral arteries.
Yeah.
Okay, so we also have, here's our scalp, here's the bone itself, this is the brain here. So this is going to be frontal lobe,
Right.
this is going to be parietal
Parietal.
lobe, and this is going to be occipital lobe.
Okay.
And then we do see the corpus callosum here and here. So that's why this is a nice slice to look at. So this is going to be our genu. This is going to be our splenium. Splenium. Tomato. It's okay. Septum pellucidum between them. Okay.
Septum pellucidum.
And there's some other things, label it as well. Again, see how that falx is superior sagittal sinus. Do you see
And
that?
so these are just pointing to the lobes, right?
So these
This
are
is
pointing
the
to the
lobes.
lobes.
Okay.
Mhm, yeah, those are the lobes. And then of course this here is the head of the caudate nucleus. You'll see that kind of outlined. And it's already labeled. So, like I said, I will talk about some things already labeled, but go back and look at them. If I don't go over a muscle, I'm not going to ask the muscle. So, you can not worry about me asking the muscle
Right.
on that. There are some muscles I'm going to go over, and I will expect you to know. Okay.
Okay.
So, but not in the brain. So, you're good to go with that. All right. So, okay, now we're kind of heading inferiorly, so superior to inferior. So what we're seeing here on this one, these are the frontal sinuses here that you see. See, those are sinuses that are holes. There's our falx cerebri. We have superior sagittal sinus here. We have inferior sagittal sinus here. We have choroid plexus. Do you see that kind of flap that's in there? That's what produces the cerebral spinal fluid. These are the posterior horns of the lateral ventricles. Again, we only saw the anterior horns here, so that's why I wanted to flip this around.
Wow.
So now what we're seeing here is the foramen of Monroe. So that is the interventricular foramen. Yeah, those black.
These right here.
So that's, yeah, this and that. Yes, it is. Ventricular foramen. If you're having trouble, right here it is. That's the other reason I put it on here. If you want to, like, for spelling and so forth, that helps you. Okay.
And then you said,
So-
what did you say?
Superior sagittal sinus.
Nope.
Inferior sagittal
Inferior
sinus.
sagittal sinus.
Choroid
This right
plex.
here, right?
or-
So, and then,
You said this was a choroid plexus?
so, I'm sorry. This is the, yeah. This
Just
is
making
it
sure.
right
Okay,
there.
yeah.
Mhm. Yeah.
Cool.
That's already marked. So is this
Yes.
asking for the same thing?
So that's asking for this here is asking for the posterior horns of the lateral ventricle.
Okay.
Okay. We still see that splenium. See how it's connecting the right and left side of the brain? So here's the splenium, the corpus callosum. We saw it here as well. Here we see right here, the head of the caudate nucleus. This is the lentiform. See where this red is? Kind of these red dots. So there's arteries obviously in there. This is the lentiform nucleus. Remember that it's made up of the putamen and the globus pallidus. Putamen is the more lateral of the two. Okay. Yep, the lentiform nucleus. This is the lateral fissure. And now this is a little complicated. So I would recommend that you label there's two boxes. So the one on the top, I would label the fissure, the lateral fissure. Because the one on the bottom is more pointing to one of the vessels, so that's middle cerebral artery. Remember, one is inside the other.
The lowest is the
So
middle.
I would say the lowest is the middle cerebral artery. Realize the one follows the other. Does that make sense?
Yeah.
So I would point here. I would say name the red structure or name this line or this kind of fissure. I probably won't call it fissure. I'll probably call it more a line or something. This dark line.
But then you would
so
say the red structure.
the red middle cerebral arteries. Does that make sense?
Yeah.
So you'd know how to distinguish one versus the other.
Okay.
Try to help you with that, okay? Again, anterior cerebral arteries. You see these following that longitudinal fissure. This is, of course, is lateral. Anterior cerebral arteries, these
Yep.
little dots. Sorry, I know I get going too
okay.
fast sometimes.
Oh, they're marked already.
So,
Okay.
and then of course we have frontal lobe. We have now, since we have lateral fissure, we have temporal lobe.
Gotcha. Yeah.
Okay, so there's our temporal lobe, and we have occipital lobe. Okay,
Is that on here, this one right here?
So-
No.
not necessarily
You're
do
just
these
kinda-
match up.
Right.
So to be honest with you, they're pretty close, but if you look on the other side, they're kind of close. Again, it depends on how it was angled when they created the image. Let me know if there's a blank you didn't get. So always let me know, and I'll make sure I get your blanks filled in. Okay.
Okay.
All right. So let's move on to this one. So on this one, we're starting to see the orbits. So remember how I said what was yellow? Yellow is a
Nerve.
nerve. So this is the optic nerve that we see.
Optic nerve. Okay.
So remember that comes back here and forms the optic chiasm. So, all right. So this is the sinuses here. We start to see some of these sinuses. We had frontal sinuses
Oh,
here.
that's cool.
Now we have the ethmoid sinuses that we're seeing. I know, this is pretty cool.
That is
isn't it?
neat.
Yeah, these are the ethmoid sinuses. Here and here. Yep. Yep. I think it's a blank for you that you have to fill in. Okay. ETHMOID. Okay. And then these, again, anterior cerebral arteries. See those? And then these are still in the lateral fissure, so these are middle cerebral arteries.
Okay.
See this slit right here? The slit is the third ventricle.
Okay.
And then on each side, we always see the thalamus.
The third ventricle looks like it was like
I know.
it's like exact.
I
Isn't
know.
that odd?
It is really odd. Like I said, I always think of it being kind of like a hand, because when you look at a hand, it kind of looks very narrow
Right.
here. But when you look at it from the sagittal perspective, it's kind of like this. So like really the palm of my hand.
Exactly.
So that's what I think of when I think of the third ventricle. That's
Like
why
a,
it looks
like a
different.
coin inside your head.
Yeah, exactly. That's another good illustration. Something that's really flat, but yet on the other side it's broader. Yeah, a good point. Very good point. So again, here's the thalamus. Here's our posterior horns of the lateral ventricles. We're starting to see the tentorium. Do you guys see this thin, kind of looks V-shaped structure here?
Yep.
And this is actually where we see, remember the tentorium, remember that straight sinus follows the tentorium? So this is my hint that this is probably draining to the straight sinus right there.
Okay.
So that's probably the inferior sagittal sinus draining to the straight sinus. Because how do I know that? Tentorium, I'm starting to see tentorium.
And tentorium is what
So,
again? I'm sorry.
This,
There's such
that's
a glare.
okay. This V-shaped, oh, I understand. That V-shaped, it's kind of brownish. Do you see that?
It's like
See
the
how it
actual-
looks It looks just like this here because it's really continuous with this dura. It's all dura matter.
So it's the actual brown piece, right?
That round, it looks V-shaped right
Okay.
here.
That's the
Tentorium cerebelli, yep. And you do have to label that, yep, on the left-hand side, down at the bottom.
It's crazy how you can even see down into like the optic.
I know, you can see her eyebrows. You see the eyebrows, and you can see the eyelashes here. So remember, this is more superior, so this is eyebrows, here's eyelashes.
Insane how the body is just so.
Yeah, you can actually see that. Any other blanks that you have?
Sorry, I'll switch over.
Need to be filled in? Anyone else have a blank? Help each other out, check each other's answers. Make sure that, no one's writing an incorrect answer. Okay? To kind of be a team here and help each other out. Okay? Okay. All right, so as we move down, now we're kind of seeing the other orbit space. We're seeing the actually bony nasal septum here.
Wow, yeah.
Okay, ethmoids on each side. These are the tear ducts, the lacrimal ducts there. So we're now starting to see the brainstem. So I want you to kind of look, and I'm going to ask you, Allison, I apologize. I want to show you guys the brainstem in the 3 parts. So here, so remember, midbrain, pons, medulla oblongata. Does everyone see that? Midbrain has Mickey ears,
Midbrain.
peduncles. Pons is bigger, flatter, okay? And the medulla oblongata gets smaller again.
Because it turns into
Okay?
the spinal cord.
Yeah, because it becomes the spinal cord. Does everyone
Interesting.
see that? And you're going to see the basilar artery anterior to all 3 parts. Remember how I said it kind of follows anterior to the brainstem? So that's what you see, that circle. Just that circle. Just the circle, because the basilar artery is coming up like this and it's being sliced just like this. So it's going to look like a circle.
Okay.
Remember that little illustration we did
Yeah.
last week? I had you cut things up. So that's what I want you to think about. How are we cutting something up? That's why I talk about this is running superior and we're going to slice through it just like this. Okay? Does
This
that
is
make
pretty
sense?
cool, yeah.
Yeah, it is really cool. So of
So
course,
these are the posterior or cerebral arteries.
yeah, these are the posterior cerebral arteries. These are the ICAs, internal carotids. Okay,
Which blank is that?
That
so
okay. Posterior.
This is
carotid
where-
arteries right here.
this is where. Okay, what do you need?
ICA.
So these are internal carotid artery. This one here.
Oh,
This is pituitary gland. That one's pituitary gland. Right here's the pituitary gland. It's a circle in the center. Right here.
Oh, that's the pituitary.
Yep, your very top left. That's pituitary gland. Remember how it's the internal carotids are on each side of it? See that? So right here is that pituitary gland.
Okay.
Okay. And here is the vermis. We see, well, actually some will label this more the vermis, but we're kind of seeing a little bit of it, and we're getting into the cerebellum. See those striations? That's
Yep.
what you look for.
What's the vermis?
So the vermis is the very top of the cerebellum.
Okay.
The very top of it.
So are we?
So
are
just
we
say
labeling
you
this
can
cerebellum
label,
or-
label that cerebellum. Correct.
vermis.
Yes. We're really getting down kind of into the cerebellum now. That is the, not yet, but that's the cerebral aqueduct.
So this one right here.
This little tiny dot back here, that's the cerebral aqueduct. That'll be on the right-hand side to label it, right here. That's cerebral aqueduct, okay? So, and then we see, I'm sorry, am I going too fast for you, Julia? I'm sorry.
I just.
We didn't label that yet.
Oh, we didn't do that yet.
No, it's
Okay.
it's actually she wants you to label this the cerebellum on this side, and then we're
This
gonna
is the tentorium again. See that brown line like we saw over here?
Yeah, that's the
That's the tentorium cerebelli.
And if you were to pin that and tell us like where to label it, you could put it right here, right?
I would probably outline this V-shaped
Okay.
structure. I'd say this V-shaped structure here,
Tentorium.
and we're just missing this right here.
Uh-huh. So this is asking for temporal lobe probably. I would guess so. Let's see what, yep, temporal lobe is something you have to label. So
So cerebral temporal lobe.
sometimes it's asking for gray and white matter. So
Cerebral
that's why I said,
peduncles.
it's probably asking temporal lobe though.
The midbrain cerebral peduncles.
Okay, so
Is that-
here's the, this is confusing where this is labeled.
Okay.
So where you've labeled it, wonderful. This is the peduncle. So kind of do a separate little star or something.
Okay.
Right over here where it kind of goes up, looks like an ear. Do a little star there and label that the cerebral peduncle. Cerebral peduncle.
It's crazy how you can see like the
So.
gray matter and the white matter.
Isn't that crazy? And so notice the difference, you guys, between the cerebellum and the occipital lobe. Both are posterior. What's the difference? The cerebellum has those striations, those lines, whereas the occipital, I say it kind of looks wormy. Whatever you want to call it, it's fine. But whatever works for you. But to me, it looks like little worms kind of going through.
Mm-hmm.
I have a long story to that, but I'm sure you don't want to hear my long story as to why I call it that. But, okay.
That sounds-
All blanks filled in? What do you need? Okay, next one. Okay, so now we're into the pons. Notice with the pons, we see the maxillary sinuses here. Okay, we also see, we're actually seeing that superior cistern here and here and here. And then we have the, what it wants you, does it ask you to label? No, fourth ventricle already labeled
Is
it
this
for you.
the cerebral
So-
aqueduct again?
So we're
Right there?
actually seeing
No.
the fourth ventricle now.
Okay.
So that's why I wanted to see what they wanted you to label here. So yeah, the fourth ventricle. So this is, of course, the fourth ventricle. What you're seeing here are cisterns. That's why I
Okay.
pointed out the cisterns, because it can be a little confusing. You see all these like
Little
circles
tiny
and
cuts,
lines, and
yeah.
what are all those, talking about? So that's why I take some time to talk about the cisterns. Okay, so again, cerebellum back
Oh, yep,
here.
you can see it
And
now.
notice the difference. That's still occipital lobe. So you get that kind of wormy kind of look there.
So that's pointing to that right there.
Yeah, that's occipital lobe. Yes, it is. And then we have, do you see the ears here?
Yeah.
To give you another perspective, here's that petrous bone. Very, very dense bone.
What is this right here?
So this,
it
which
pointing to
one
that?
here, it's pointing to the transverse sinus here. We have superior sagittal sinus here. We have transverse sinus over here.
Okay.
Okay. Anything
And those are
else?
lined with the blue because they're veins.
She's missing sphenoid sinus on the left-hand side. There's your
I am too.
sphenoid.
Right here?
So right here. Yes. Sorry, didn't mean
No,
to
you're
poke
fine,
you.
you're fine.
And this is maxillary sinus here. On the right-hand side, you got that one. So these are where the maxillary sinuses. We'll see them more here too. Okay. Anything else need to
Yeah,
be
we're
filled
missing the
in?
one right above the pons.
Which one? This one here, basilar artery.
Okay. Is it right above? Oh, right here. Yeah,
right
okay.
Yep. Basilar artery. And we do see internal carotids again. Do you see the internal carotid arteries?
Yeah, those I can always point out.
Yeah, they're easy, I think, to pick out because they're right,
They're right in
now
the
they're
center.
going to move sideways, and that's what
Right.
you're going to see
Over here.
here and here. Yep, you're seeing them here, and then on this
And
one,
that's still
I
the basilar
apologize.
artery?
Yep, still the basilar artery. I'm going to have you pick this up. Notice how we see two now.
Yeah.
Okay, so that's going to be your internal and external.
Okay.
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 The internal and external. So you'll see that already labeled, but I just wanted to point it
So
out
we're
to
on
you.
this one.
So, yep.
Okay.
We're on this one. Make sure everyone can see.
So-
Can you see okay, Julia? You're
Is this a
welcome to come
sinus?
around here if you need
Maxillary
to.
sinus?
Maxillary sinuses. Again, bony nasal septum. Here's the nose. Again, we have medulla oblongata, anterior basilar artery. This arch here is the start of C1. That
Okay,
is
yep.
a bone. That is the start of C1. It doesn't have you label it. It doesn't
But
label
this
it.
is right here.
Yeah, but I think it'll help you when you look at the next one. What I'm trying to show you here.
And then
So, okay.
basilar artery.
Yep, basilar artery.
Okay.
Where are we at here?
What else does it have you label? So cerebellum, of course, back here. We have the fourth ventricle here. I don't know if it's asking you to label these.
Right
but-
here? Fourth ventricle?
Yep.
Yep. And then
See how it looks like an unhappy mouth?
Yep.
On this one, it looks unhappy, I think.
This one?
Yeah. See, it kind of looks like a upside, like this almost. It's
Yeah.
almost shaped like this, almost
And
like
then
a.
this is just asking for the
So-
cerebellum.
So this is the cerebellum back here. Yes, that's the cerebellum. And then, of course, the ears and the. Okay, anything else you had to label on that one? Again, kind of look over some of the ones you didn't have to label. Okay, so this is the last one. Here's the teeth. She has a filling. See that? She
Wow,
has a
yep.
filling right there. This is the tongue here. Now you just see the happy mouth? Okay, the happy mouth is the pharynx.
Okay.
The happy mouth is the pharynx. So you'll
So
see it
the
already. I
smile,
think it's labeled
pharynx.
for you.
It is. Oh.
It's right here. See that? It's already labeled for you, but I wanted you to see that. I didn't want you to mix the two up. Unhappy mouth or
Or
the
ventricle.
ventricle. Happy mouth, pharynx.
But
And
it's
notice how it's a
also
little more
like right
interior.
behind the palate. Like
Yep,
right.
and it's more interior. Notice that. Usually see the tongue and the mouth, usually when you're seeing that. Yep, she's right. So this I wanted to show you. This is more of that ring of C1. Okay, so that's why I wanted to point it out to you. So you're going to label it on the left-hand side down at the bottom.
C1.
C1. So I want you to label it C1.
Okay.
Okay, and then on the right-hand side, there's a circle. So this is it right here. That's the dens of C2. It's one of the
That's
few.
what we were talking about.
Yeah, that's one of the few I'm going to make you number. You do have to number it.
Dens
Dens,
two.
or you can call it the odontoid process of C2. Same thing. You pick whatever I would probably pick dens just because it's
A
easier.
little faster.
But you certainly can call it DNS. You can call it either one. It's fine. This is the spinal cord back here.
Oh, wow, yeah.
Do you see here? Here's those vertebral arteries. See, here's the basilar
Yeah.
artery. Here's the vertebral arteries.
So right in here.
So, yep, that's the vertebral artery. Sure is.
Pretty
And you
neat.
said
Yeah,
that
that's
this is
really
the
cool.
spinal cord right here.
Yep, that's
that we're
spinal
pointing
cord.
to.
Yep.
All right.
And these here are the parotid glands. You're going to label on the right hand side.
Parotid?
Parotid. P-A-R-O-T-I-D.
Gland.
There you go. Yes.
Okay,
Say
yeah.
Does that make sense?
Yeah.
Okay. All right. So come back later, kind of look over anything that we